Hello everyone, welcome to my channel, Wellness with Dr. Mariam. And today I would like to welcome with us Dr. Lim Keng Hua, who is an ear, nose and throat specialist. Okay, and before we start with this session today, first I want to say I'm really grateful for everyone who is live with us today. If you want to ask questions, you can write your questions at the comments in the YouTube, so that at the end of the session, we will have a bit of time for Q&A. And I will, if there are a lot of questions, I'm going to select questions that we will pose to Dr. Lim. But if there are less questions, don't worry, because I already have lots of questions for Dr. Lim, because it's not every day we get to speak one-to-one with an ENT specialist, right? Okay, so if you have gotten on my channel, please like and subscribe the page. I have a lot of talks ongoing, like every week, and we have special invite every month. So I would post quite a lot of videos on my channel. So if you click the subscribe button with the notification bell, you will get notified whenever I post up a new video or go live. Okay, I'm going to start by introducing Dr. Lim. First, thank you, Dr. Lim, for coming on board with us today. And I will give you a bit of introduction. I would say a short biography, because his biodata is very long and very impressive. So just to introduce briefly, okay, Dr. Lim Keng Hua is an ear, nose and throat surgeon at Mount Elizabeth Hospital, Singapore. He has more than 19 years of clinical experience in adult and pediatric ENT conditions, with special interest in nose allergy and sinus diseases. So Dr. Lim was also involved in taking care of the patients during the SARS pandemic. And Dr. Lim is a lecturer, clinical tutor, and also an examiner. Okay, so for those of you who are going to take exams, so remember Dr. Lim. And okay, Dr. Lim also often shares his knowledge with the public in health articles and in forums, as well as interviews on various media channels. And the most recent one that he has on the media is with Talking Point, where he talked about the smell loss in COVID patients. Okay, so without further ado, I would like to invite Dr. Lim, who will share with us today on the topic of sinus issues in children. So Dr. Lim, welcome.
Yeah, thanks, Dr. Mariam, for giving me this opportunity to share with her group and with all of you here on sinus problem in children, which is something pretty common, and I think many parents, very close to many parents' hearts. Yeah, so the classical symptoms of sinus is, the child will wake up with a nose itch, sneezing that will last for several minutes, runny nose that come out spontaneously, and nasal congestions. Right, and we are all very familiar, often overlap with that of flu, and we call this sinus. But what really is sinus? Sinus is really a form of nose allergy, and the medical name is allergic rhinitis, a clinical disorder where the nose becomes inflamed because of exposure to something that the child or the person is allergic to, what we call allergen. Happens about 5 to 15% of population, and an allergen is essentially something that causes an allergy, maybe inhale or ingest. Very quickly, we can go through some of the common allergens. By and large, the house dust mite is the most common, accounts for about 80% of the cases. Cockroach as well, moles, and certainly certain pets like cats and dogs, which is a common pet in Singapore, and even grass and pollens. Some of the less known allergens like food, for example, nuts, eggs, chocolates, milk, chicken, all this can cause some form of intolerance or allergy, and they may present with either more phlegm or mucus. So besides that, there can also be symptoms like eye, for example, what we call allergic conjunctivitis, leading to sore eyes or itchy eyes. Ear symptoms like blocked ear, and in a child, it becomes Very important because it affects their hearing and speech and language development. And throat symptoms like throat clearing or sore throat as well. So just give you an example. This patient is 3 years old with persistent runny nose. Basically, this child start going to childcare at the age of about maybe about 1 years old. And since then, the mother thought that it's common for the child to have a bit of flu-like symptoms when they first go to childcare. So has runny nose, perpetually, very frequent, seen a lot of GPs. And when he finally saw me, I asked the mom, how long has he had this flu-like symptoms? He says, oh, actually almost 2 years since the time he goes to childcare. And you can see him, the mucus is coming out all the time, he's mouth breathing. And when I scope the patients, I can actually see a large adenoid which is blocking the nose. All right. And what is adenoid? Adenoid essentially is a tissue at the back of the nose. All childs will have it. And this will grow with age until the time about 12 years old before it becomes small again. And what it does is that it may block the eustachian tube and hence causes a ear problem, what we call a hearing loss. And usually associated with large tonsils as well. So why child has a more likely problem of a middle ear issues when they have adenoids is because the eustachian tube is more horizontal in the child compared to an adult, which is more angled. Yeah. So for this child, when I scope him, I can see there's an air bubble, right, behind the eardrum, or what we call the middle ear. This is as compared to a normal eardrum. And when you scope him, the whole nose, at the back of the nose is totally blocked, and you can see that the mucus cannot even flow down, it's just hovering at the back of the nose. So for him, I had to remove the adenoids, as well as to make a little hole on the eardrum to drain out the fluid and put in what we call a ventilation tube to allow air to fill up the middle ear again. So this is the note that the mommy sent me at the end of everything. So they were very grateful because the child could now hear better, starts talking again, and no more mucus coming out from the nose. So why should we treat nose allergy? Well, control symptoms, certainly improve the quality of life, and of course, cost effectiveness, especially in adults. In children, it can also prevent the development of asthma because it reduces the throat irritation, as well as prevent exacerbation of asthma. All right. In the long run, if you control the allergy well, it prevents polyps formation in the nose and also prevents things like chronic blocked nose, which has a lot of long-term side effects. So some of the effects of blocked nose will be this. Of course, when the nose is blocked, you can't breathe well, so you increase the breathing effort. All right, it leads to mouth breathing. Right, the smell will also be affected, and indirectly, taste will also be affected. Right, it may also cause congestions over the sinuses, which sinuses are actually air spaces on our forehead and as well as over the cheek, and there can be fullness and pain. Ear fullness, as I described earlier, and post-nasal drip, which is backflow of mucus to the throat leading to cough. There are a whole host of problems with mouth breathing. You can find these from the web. Yeah, but I think what is very pertinent to a child is this. If a child is mouth breathing, all right, because of the arrangement of the muscles, the mouth is always half open. They tend to develop a longish face. All right, as a result, they grew up having a smaller chin, overlapping teeth. They normally have an overbite. All right, yeah, and they somehow have a longer face. And this is well illustrated. This is a child that was 9 years old. Look at him. All right, this is how he looks like at 9. He got a pet and he was allergic to the pet, but they didn't know. So 2 years later, right, he starts to mouth breathe and notice his face start to change a little bit. And another 2 years later, at the age about 14, this is how he looks. His chin become more low set, all right, and his mouth breathing and his facial development has been affected. So what is the consequence of this is that if you have a smaller chin and your tongue will be more posteriorly based, and when you grew up, right, the person is more likely to have sleep apnea or snoring issue, because in sleep apnea or snoring, it is when the airway become partially blocked or totally blocked. And hence, if you have a smaller chin and your tongue is more posteriorly based, you are at a higher risk. Okay, so how do we manage sinus problem? Patient education, very important, is I think is the most important, followed by allergy tests, medication. We can do immunotherapy and surgery. I'll just quickly go through them in view of time. So to manage them, generally I divide them as sneezer or blockers. Sneezer is due to allergy, they need medicine. Blockers is structural, they will usually need some form of douching to clear the mucus or decongestants. All right, and when we scope patient, we see thick mucus like this, so we need to wash them out. We look out for large adenoids, large turbinates. So turbinates are structures at the side wall. This can be big, the bone can be deviated, and sometimes I even see this in child at the age of maybe 9 or 10 because of frequent rubbing of the nose. The cartilage starts to be deviated. We can do surgeries to correct it, but I don't do cartilage surgeries in the child. I only do this when they are about 15, 16 years old onwards. If the child is very blocked, what I may do is reduce the size of the turbinates. I will not cut the turbinates. This again will only apply to older kids or adults. So what is done is that you can see this is swollen. If we put in a decongestant, they get a space, they breathe again. If we do a surgery, we can get them a space to breathe again. And this can be long-term to give the child a chance to breathe well, and also for various reasons. And I can tell you, these are what I noticed. First of all, when you do a reduction, you increase the space within the nose. It allows them to douche their nose better. At the same time, you also reduce the surface area of contact to the allergens, and hence, for some kids and some adults, they become less allergic, less swollen, and less mucus. So as you can see, if it's a structural problem, if we treat it well, it also helps to control the allergy. All right, and the last thing is you can do immunotherapy. If the child is allergic to dust mite and we do have the allergen, the child potentially we can desensitize the child from the allergen and for them to have a chance of cure, right? So after a vigorous program, with a success rate about 60 to 70%, the child can be desensitized to, for example, dust mite, and hence no longer allergic to dust mite. Okay, with that, I thank you. You can, those who have handphones, you can scan the QR code here, and you go to my Facebook, and you have questions that we can't answer later, you can drop me a question there as well. Thank you. And these are my contacts. If you have my clinic and our website, and this is the email. Okay, thank you, Mariam.
Okay. Thank you so much, Dr. Lim. I think I've learned a lot listening to what you share with us today. And to the audience, if you are watching live, if you have learned something today, also, like click yes and say that you learned something. What are the learning points that really, make you go like, wow, okay, I didn't think of that. Okay, so now I want to go through some questions that we got from some of the participants who registered, and they have sent in the questions earlier in a form, and also some of the common questions that mummies always discuss in, we have some mummy forums. Okay, so one of the first question would be a home remedy. So, Dr. Lim, if let's say somebody have blocked nose, or like all this runny nose, and then let's say if at home, it's at night, it happens, and the mommy wants to use a home remedy, like are there any home remedies that you think that would be safe and can help before maybe they want to go to the doctor the next day, or maybe they want to see if it can alleviate and it's not serious enough to take medication.
Yeah, so for I think sudden blocked nose, if you have a saline spray, it will be helpful. All right, you can use a decongestant nose drop, which is also over the counter, but for emergency use. But that is not for long-term use, because long-term will cause you damage the lining within the nose and cause what we call a rebound phenomena and hence more blockage. Other ways includes if you have eucalyptus or something to steam, breathe in, it can also help to decongest the nose and clear the blockage. So I think some essential oils are useful. For this, you can ask Dr. Mariam because she's a better expert in this and not myself. Yeah, but usually my patients, they will have some medication at home. They will know what to do. I teach them what to do in emergencies and what to take if there's a sudden flare.
Yeah. So okay, thanks for sharing that with us. And yeah, I do use essential oils, and of course, that for children, there are um, safety concerns when applying essential oils because not all oils are suitable. So I do hold classes for that. So for parents who want to know how to use essential oils. So just now you mentioned about the nasal spray. So there are different types. There are some that I found which are like, like they spray, and then there are some which are like nasal irrigation. Are both of them effective, or do you like recommend one or the other?
Okay, so there are many kinds of nasal spray. You have the saline or sea salt, seawater nasal spray. Those
Mm,
can be in a spray form or a bottle form in the form of douche. There are also steroidal nasal spray. This usually need a prescription. You get it
mm,
from the family physicians or the specialists or the doctors.
mm,
There are also nose drops or some nose sprays. They are over the counter. These are decongestants. These are not this is the one that I said shouldn't be used long term, maximum maybe up to 5 days to 7 days. And you have to be very mindful of the dosage used because in children, we have to use a much lower concentration. So if you have any doubts, ask the pharmacist in the pharmacy itself for advice. They should be able to advise you. Otherwise, if you are seeing a doctor, the doctor will know exactly what dosage to give,
mm.
instead.
Okay, thanks for clarifying that. And I think this is important, and I should have mentioned a disclaimer right at the beginning that this whole session, right, it's for informational purposes. It's to give some background knowledge for the parents and for listeners, but do not use this to self medicate or it's not to replace any medical consultation. So if the children do have a blocked nose and it's best to see a doctor. Okay. And okay, yeah. So now going back to seeing the doctor, right?
Mm.
How serious enough do you think that okay we can try at home? And because when we send the kids to preschool, I think almost everyone will say that it is very common for the children to get runny nose, to get flu. So, how common is common, and what is normal, and what should we be concerned about? Because you share about the 3-year-old boy just now. So, can you give
Mm.
us a bit of insight on this?
Yeah. So on average, child will have uh, about 5 to 7 flu per year.
But
All
yeah,
right.
about what age? About uh,
In a child, all right, maybe preschool, all right, nursery, kindergarten, all right. The younger they are, of course, the more frequent it is because their immune system may not be mature, all right. They are also more allergic, all right, and they carry more viruses. The other thing is in a very young child, their sense of hygiene is also lower. They are touching everywhere, sharing mucus. So
building up the immune system, lah.
yes, correct. So it does cause a lot more infection. So for a young child, the younger they are, let's say you put a child in the child care at 6 months or 1 year, certainly there are a lot of more flu in the initial stage. All right, so I say about 5 to 7. Usually each flu-like symptoms may last about a week, maybe 2 weeks, but they should get better. The very important thing, there should be well intervals. It shouldn't be persistent. If it's
Like
persistent, it's
what kind of
unusual.
interval? Like how long? I think
No, they
my
should
kids,
be,
yeah, they have like 1 week interval between flu in the beginning when they first started preschool.
yes,
That
yes.
normal.
But at least they have a well interval. All right. It's not, it shouldn't be persistent, no, like having flu for one month, 6 weeks. That's unusual. All right. Something is, there must be a missing link somewhere. I mean, and usually there is some form of hypersensitivity, some form of allergy, all right, or unless the school's hygiene is so poor that really there's no chance for the child to get well. Because if the child is constantly unwell, it can affect their growth, right? They are using a lot of energy to recover, so less energy goes to growth per se. All right, yeah. And the other thing is, like I mentioned, from 2 years old onwards, the child will start to have larger, the lymphoid tissues will be more prominent. So there are larger adenoids, which is the one I showed earlier at the back of the nose. Adenoids will start to develop from the age of 2 until 12. All right. And during this time, if there are a lot of flu, the adenoids tends to get even bigger. If there are allergic rhinitis or sinus problem, the adenoids also tends to be bigger. And with a large adenoids, it can lead to blocked nose, it can lead to blocked ears, and with blocked ears, it leads to hearing loss. And from there, it may even cause speech and language development problems. So there can be speech and language delay. All right. Like the patient I discussed, for this child, he when I saw him, how I pick up is I noticed the child is very quiet. So when I asked mom said, "Oh, he has been quite a good boy. He's very quiet at home. He's always playing his toys. He doesn't talk much. When he talks, it's just monosyllabic word." And when I speak to the child and finally get the child to speak, I notice his articulation is all wrong. He's just cannot pronounce properly. And that's how I decided to do a hearing test and noted that he actually has I mean, I did an examination and saw water behind the eardrum, and then did a hearing test to confirm that. And I told the mom that the large adenoids, the mucus in the nose cannot flow away because there's large adenoids, and it's a chicken or egg thing. The mucus causes the large adenoids. The large adenoids prevent the mucus from flowing to the throat. So hence it's always overflowing at the front of the nose. And this child, you can really see mucus is coming from the nose all the time. And he's like opening his mouth all the while. All right. Yeah. So these are symptoms that you can look out for in a child who has frequent flu. They should recover. They should be well in between, and then you'll be fine. But if it's persistent, check with your family physician. They generally can advise you, and you really need to uh, either see a pediatrician or see an ENT specialist because we can do a scope and
Yeah.
confirm all this.
Yeah,
Yeah.
I think it also makes a difference because you mentioned for the 3-year-old boy that they went to the GP and the GP say it's normal, right? But also because the GP doesn't, it's not the same GP that see the boy every time. Let's say when we go
Yeah.
poly.
So
So
the thing is, uh, because otherwise the child looks quite fine. So you generally have to be pretty, uh,
observant
I
lah.
mean, yeah, observant. And the other thing is, full medicine can be obtained quite easily. So sometimes, the parents may also self-medicate. Anyway, it's just runny nose, right? No fever. The child can still go to school. The child is not coughing. So to the mom, this is normal. It's just clear runny nose coming out all the time. Occasionally yellow. So like what Dr. Mariam said, it's important to always see the same GP. Don't doctor hop, so that the GP can have the record and decide whether this is too frequent for comfort,
Yeah.
or decide that maybe you should see a specialist. Yeah.
Yeah, and also maybe to note because like for some people maybe they don't have a family doctor. If they go to the GP, but they themselves feel that is very frequent, then they can actually request the GP and say that they want to see an ENT specialist.
Yeah.
Because I think
I,
when they request, then the doctor will say, okay, we can give you a referral. You
yeah.
can go to.
I mean, I do have patients who come and see me, or parents who brought their kids to see me without any referral. The
Okay.
parents just
Yeah.
decide, because sometimes uh, I mean, we can use medication, but if the control is not ideal,
Mm,
uh, sometimes some parents will be concerned and they will start to look for alternative. And
okay.
the difference is that I can do a more thorough and invasive
Examination. Yeah.
examination, and we normally yeah, to find the root cause. And my philosophy is, if when I see a child, I never make the child cry. I
That's
really
good.
take my time, talk to the child, and try to make friends with the child, because I don't want them to be traumatized.
Correct. True.
My kids, when they come, they have to go out, and then next time they come back, they feel happy coming back. Some of
Mm.
them are eager to come back, because they want to have the sweet that I gave them the previous time, or the toys that I gave them the previous time.
I think that's very important because I mean I have three kids myself, and I totally understand when they are traumatized by the doctor, they don't want to go again. So far,
Yeah.
I mean it's been good, but yeah,
Yes.
that's very nice that you have that in mind. Also, you're mindful about the psychology effect. Okay, we have a question on the live on the YouTube, so I will take this one, and this might be the last question. Okay, so Terence asked, my 4-year-old son's symptom always appear in the night before and during bedtime, and also in the morning, and he has eczema. Doctor says his sinus is repeated to that as well. Okay, can you please advise?
Yes. So so I hear that this child has sinus problem, has allergic rhinitis, has eczema. They are similar disease. They are part of hypersensitivity. All right. The trigger may be overlapping or separate. All right. So dust mite can also cause some form of eczema or itch as well if the child is very allergic. Okay. So if you say the symptom is worse at night, then we want to look at first, I always look at the trigger. All right. So usually if it's worse at night, worse in the morning, the trigger is related to the bedroom. And in the bedroom, the most likely cause is dust mite. Okay, because dust mite likes to hide in the mattresses. They feed skin shedding. They love dark, warm environment. So they're usually mostly found in the mattresses. Yeah. The other possibility is, of course, if the temperature in the room is too cold, the child may be a bit sensitive to the cold as well. But usually in these cases, the most likely cause is still dust mite. Yeah. And if you have pets at home, it's possible to be allergic to the pets as well. My general advice is you can either do allergy test. If not, try to train the pet to have the pet outside the bedroom, and certainly don't go to the bed, sleep with the child, because if the child is allergic to the dog and you're sleeping with the dog, then no matter how many times you see the doctor, how much medicine you take, you realize the control is less than ideal.
Mm, okay. Okay. So, all right. Thank you so much for that sharing. Um, Let me see. I'm gonna share screen now. Um, Let me see if I. Oops. Okay. Yeah. So I like to also mention that we have this. I'm gonna have another workshop or seminar coming up, and it's called the 8 components of wellness. So in this seminar, what I'm going to talk about is what are the different aspect of wellness that we need to take to be mindful of. And of course, one of the aspect of wellness is of course medical intervention. And also I will mention about the work life balance, how to achieve work life balance, and it coupled together with the wellness. And of course there'll be invaluable knowledge and insights not just from me, but also from some other experts. Okay, and actually, it is valued more than 98 lah. I mean, we don't really charge a huge amount because we want to share the knowledge with everyone. But for those who have attended today, whether you are seeing it on YouTube or you are seeing it through the Eventbrite, okay, there is actually a special offer that you can get this at 28 for now. Okay, and so I highly encourage you to participate in this. There will be recordings provided for those who register, and this will not be the public event. So because we want to have discussions with the participant, and you can find it on my Eventbrite, Wellness with Dr. Mariam, and also participants will get some products from a few sponsors from Grosseja, Vita Kids from my own company, Wellness with Dr. Mariam, and from Lilo. And that itself is probably worth more than $30. So I think even if you register, you already get worth whatever is worth from the products. And also, if you want to find me, you can find my platform on YouTube, Facebook, Eventbrite, Instagram, as well as my website. Okay, so we have come to the end today. And again, I would like to thank Dr. Lim on behalf of all the participants and also, from myself for coming on board on my channel today and share with all of us your knowledge in the ENT aspect for children. And of course, I mean, it's not just children because I think some of them, of course, also apply to adults. So I find it has been a very insightful session. And of course, I've gained a lot of knowledge on this area, which is not my expertise because I study cancer. But, ENT is, as you say, is really a huge, it's close to heart for parents because all parents will have this experience with, like whatever the ENT conditions in children, especially flu, cold, sinusitis. So thank you very much, Dr. Lim, for sharing your knowledge with us. And we hope to see you again. And Dr. Lim will also be sharing about sleep, something about sleep wellness, and the health aspect of sleep in the our upcoming talks in the eight component of wellness. Okay, so thank you very much again, everyone, and we're gonna end the session today, and keep on lookout for our upcoming seminars. So thank